Hey everybody, Travis Kern here from Root and Branch Chinese Medicine in Portland, Oregon on my usual drive into the shop, and I wanted to take a minute to talk to you guys a little bit about what makes Chinese medicine different than some of the other types of medicine you might have experienced. And one of the major things that stands out to me is something that we call pattern differentiation, right? Pattern differentiation. And what that means is when we look at a patient and we try to figure out what is it that's not going optimally for this person, we have to look at a variety of things, right? Now, most of you are probably familiar with going to your regular doctor, your regular physician, and that person is going to take some vitals, right? They're going to take your blood pressure, they're going to weigh you, they're going to maybe listen to your lungs, although that happens increasingly less frequently, but hopefully they're doing something like that. And then additionally, if something serious is going on, they might send you out for a blood test, they might have a hormone panel done, they might look at your cholesterol. There's all number of sort of physical assessments. If you've got some kind of injury going on, maybe they'll test your range of motion, see where the pain is. We put all of this into the category of physical assessment, right? And that physical assessment is trying to look at what's causing your disorder. What is the cause of disease? It's an important thing to think about, what is the cause of disease, right? Because there's three, I would say, major categories that we think of as disease-causing agents, right? The first one that most people immediately think about is pathogen, right? That is bacteria, virus, mold, those kinds of things that consistently cause disorder for patients, right? They infect you, they grow, they multiply. We're very familiar with those, right? Those items. Another thing that causes a lot of difficulty for people in Chinese medicine, we refer to it as deficiency. But even from a biomedical point of view, deficiency is a very real thing, right? People can be deficient of nutrients, they can be deficient of hormones, they can, their blood cells can even be deficient with something like anemia or some sort of autoimmune disorders. And so those are things that are lacking in the system, right? So pathogen is something that comes into the system. Deficiencies are disease causers because of something lacking in the system. And then the third big category is something we just call trauma, right? So physical trauma, like twisting an ankle, breaking a bone, getting hit by a car, those sorts of things. And then the other categories of trauma, emotional trauma, mental traumas, stressors, spiritual traumas even. These are factors that impact people's lives concretely, like physical things, or maybe a little bit more tacitly when it comes to mental, emotional, spiritual traumas. Regardless, those are also outside inputs that cause disease. So when we do a physical assessment of someone, we're looking at those factors and trying to figure out what's the cause of this person's problem, right? But what happens if you go to your Western doctor, your biomed doctor, and your blood tests come back normal, your MRI scans come back normal, your hormone levels are regular, everything seems to fit perfectly within its own category, right? What happens then? Well, you're fine, right? Except, of course, that you have a headache every day, right? Or you have chronic, deep aching muscles every day. And all of the tests, all of the physical assessments come back and say, you're fine, right? Everything's fine. Oftentimes you'll hear something like, well, it's psychosomatic. That's a fun phrase everyone likes. So it's in your head, basically, as a statement. Your mind is creating this illness when there is none. Chinese medicine likes to look at it a little bit differently. We have another set of parameters besides the physical assessments that we call lived experience, right? That is literally, you are the person living in your body, right? It's your body, you're living in it. And so your experience of your health is absolutely as important, and I would argue more important than the physical assessment, right? It is more important to me what your perception of your health is than what the blood panel says your health is, right? And this is a bit of a controversial topic because there are diseases, biomedically defined diseases, that you don't have any symptoms for, that you have no experience of, and the only way to figure them out is to find them in a blood panel, find them in a preemptive test, and to do some kind of usually surgery or pharmacological intervention in order to prevent that disease from taking hold. And it's hard to argue with the clinical evidence of that. I would push back though, and this is a purely, I would say, anecdotal pushback, but I would push back with the question of, were there really no symptoms, right? And that is to say, okay, maybe you weren't like bleeding out of your eyeballs, right? Or had some horrible pain. But if human beings were more in touch with our bodies, right? If modern people were more in touch with normal and understood that going to the bathroom 6 times a day with loose stool is actually not the ideal scenario, that's not okay, right? Maybe there were symptoms, right? That's my only real assertion. Maybe there were actually symptoms, and you didn't think that there were symptoms because no one bothered to tell you that those were things that you should look out for, right? It's anecdotal. I can't prove that. We'd have to do a really intense, long study to figure out if that was the case. But regardless, Chinese medicine is concerned deeply about the physical assessments as well as your lived experience, right? So imagine for a second that you had a patient, or you, maybe, someone you know, has a whole host of seemingly disconnected symptoms, right? Dizziness and vertigo, extreme irritability, gas and bloating, loose stools, worse with stress, frontal headache chronically, occasional migraine with nausea, cold hands and feet, deep muscle ache. Let's see what else we might include in there. How about maybe just regular nausea, maybe even vomiting, acid reflux. Okay, so those symptoms, that list of symptoms, comes from all different organ systems biomedically, right? And could result in diagnoses like hypothyroid. We could have irritable bowel syndrome. We could have Meniere's disease. We could have fibromyalgia. And you might have a person who has all of those symptoms and all of those diagnoses, and then they'll have a whole host of pharmaceutical interventions for each of those conditions. And some of those interventions might conflict with each other. Some of them might be complementary. It's hard to say without looking at a particular case. But suffice to say, there will be a lot of points of attack, right? Might even be some physical therapy. There might be some counseling. Who knows, right? It's broad spectrum. A lot of conditions to treat. In Chinese medicine, all of those symptoms could fall under a single banner, something we call liver Qi stagnation, right? Now, liver Qi stagnation, if you're not a Chinese medicine person, probably doesn't mean anything to you. And that's okay. You can certainly learn about it more by watching videos like this one. But the important factor is that all of those symptoms are actually connected. They're not disparate pieces of a disconnected human body, right? Your head and your feet are attached to the same you. You live in that you all the time. The symptoms that you have at your head and your feet and in your calves, right, and in your guts and in your poops and in your vomits are all the same. They're all connected. They're not separate pieces, right? They are not separate pieces. And if you treat them as separate pieces, the likelihood of resolving one item when another one could just as easily pop up is going to be like playing whack-a-mole. Sometimes it works out, right? Sometimes, bodies are very resilient. They are very resilient. Even with no intervention at all, people tend to survive in the modern period because we have clean food and clean water in the developed world, relatively good sanitation. Bodies are very resilient, okay? But imagine if instead of playing whack-a-mole with your disease, that you decided to seek a type of treatment that could actually address all of them at once, right? That in a combination of therapies, acupuncture, Chinese herbal medicine, heat therapy, cupping, Chinese-style massage, in addition to lifestyle, right, diet, there's a lot of avenues to take, but that the treatment could all be harmonized and focused toward a single outcome, toward treating a pattern, liver Qi stagnation, as opposed to a series of diseases, right? As opposed to just a collection of symptoms. We, as Chinese medicine practitioners, have been highly trained to assess the pattern, to look at things that seem disconnected and find the connection in them. And the benefit of that is it gives you the opportunity to focus your treatment and to potentially get better more efficiently, right? Which I think is valuable to everyone. And on top of that, for my own patients, I know it's very satisfying to talk to a practitioner who isn't telling you that it's all in your head, right? Who isn't telling you, oh yeah, sorry, wish we could help. Maybe you should get a little sicker first. before we fix this problem, right? So think about the ludicrousness of that, right? You walk in to see your doctor and they're doing an assessment and they look at your feet and they notice that you've got a toe fungus growing that has actually like deformed your toenails and is having like skin slough off your feet. And the GP and the dermatologist are both like, it's foot fungus. What are you going to do? Maybe some foot soaks, a little topical. It's not that serious. It's not that serious. Your toenails are deformed and your skin is sloughing off. Like it is literally falling off of your feet. And it's not that serious? You should get sicker first? I mean, what are you talking about? Yeah, okay, it's not going to kill you, right? You're not going to die from that. That's true. So from that point of view, I guess it's not that serious. But little tiny pieces of your health reflect the broader picture of your health. The idea that you would just leave something unmanaged because it's not going to kill you or make something fall off is insane, right? This is the kind of disconnect that I'm talking about. By treating individual pieces of your health as single items, okay, you don't end up with treatment for the whole. And those little tiny things collected over decades of health result in a whole host of problems, okay, that need to be resolved. How often are people talking about, oh, well, when I was younger, we didn't have that problem? It's like, well, you had little problems like foot fungus growing on your toes for the last 15 years, but nobody wanted to do anything about it. Why is that there? Why did that grow there? Other people don't have foot fungus. There must be something going on. There's some kind of imbalance that needs to be fixed, right? Let Chinese medicine assess your symptoms, disparate though they may seem, separate though they may seem, so that you can end up with a pattern, a single focus, right? And don't get me wrong, patterns can have sub-patterns and items. People don't walk in like they're a textbook. I'm not saying it's that simple. But I am saying that treatment can be focused and organized in a way that will actually serve you, right? That will actually serve your outcomes and your ends and help you to be healthier. This is Travis Kern from Root and Branch Chinese Medicine in Portland's Multnomah Village. Come and see us if you're local. And remember, Chinese medicine does it better. Have a good one, y'all.